Here are 3 things to remember when you're working with an older adult. Ageism is discrimination against a person based on their age and can be a major barrier to discussing symptoms that are attributed just to getting older. Stereotypes or assumptions about aging and old age can be very harmful. They often lead older adults, caregivers, and health professionals to ignore or minimize certain problems, such as hearing loss, memory loss, or urinary incontinence. Instead, they believe that the cause is just aging and not some outside source, such as illness. Remember that aging alone does not cause illness, and growing older does not automatically mean that an older person has to live with pain or discomfort. An older adult may be afraid to communicate because they assume they will lose their independence if someone discovers all their problems. Older adults have various unique life experiences, just like younger adults do. A 90-year-old is from a different generation than a 70-year-old. You may see weaker 60-year-olds and healthy 80-year-olds, and may even come from a lot of different cultures. We encourage you to view all older people as individuals who have a wide range of caregiving needs. Here are 5 things to remember when speaking to an older adult. If you are a professional caregiver, ask the older adult how they prefer to be addressed by you. Some prefer Mr. or Mrs. and their last name. Others prefer if you use their first name. If you're a professional caregiver, avoid using familiar terms like dear and honey, which may sound like you're talking to a child, not an adult. Give older people plenty of time to respond to your questions and comments. Speak more slowly than you would to a younger person. Older adults often need more time to process what is being asked or said. Try to slow down if you speak quickly or have an accent different from what they are used to hearing. Give them time to better understand what you are saying. Be an active listener. Observe facial expressions and gestures. Face the older adult, maintain eye contact, and when he or she is talking, use frequent brief responses such as, "Okay, I see," or "Uh-huh." Active listening keeps the discussion focused and lets them know you understand their concerns. Watch for opportunities to respond to older adults' emotions, using phrases such as, "That sounds difficult," or "I'm sorry you have this problem." This is called empathy, or the ability to understand what another person is feeling. Research has shown that this can help the care recipient feel better cared for and more likely to accept treatment. Empathy can be learned and practiced.